Acromegaly. Acromegaly occurs due to excessive growth hormone production after epiphyseal closure. What are the causes of acromegaly? Usually is due to somatotroph adenoma in the pituitary, but may also be due to idiopathic hyperplasia of the anterior pituitary. It may also be due to ectopic production of growth hormone. There is generalized visceralomegaly, cardiomegaly, macroglossia, and glandular enlargement. Causes bitemporal hemianopsia, and there is frontal bossing also. There is increased hand and foot size, and there is increased shoe and glove size. Patient complains that his head got smaller or the shoes got smaller. What are the effects on lower jaw and joints? There is prognathism, protrusion of the lower jaw due to overgrowth. There are widened spaces between the lower incisor because of the overgrowth of the lower jaw. So what are the effects on joints and bones? Osteoporosis, osteoarthritis, arthropathy, and kyphosis. And what's the X-ray feature on the X-ray spine? There are biconcave fish-like vertebral bodies. And what are the effects on soft tissues? There is large fleshy nose, hyperhidrosis, and oily skin. There is increased heel pad thickness due to soft tissue swelling, and there is carpal tunnel syndrome. And what's carpal tunnel syndrome? It's due to entrapment of median nerve at the wrist joint under the flexor retinaculum. Median nerve supplies a lateral 3.5 finger including thumb. So they get pain and numbness in these 3.5 fingers, while medial 1.5 fingers are supplied by the ulnar nerve. Effect of acromegaly on carbohydrate, protein, and fat. Most patients have abnormal GTT, and 25% of the patients develop diabetes mellitus. The protein content of the body is increased and fat is decreased. And what's the effect on respiratory, gastrointestinal, and cardiovascular system? In the respiratory system, sleep apnea occurs in more than 60% of patients. In the gastrointestinal system, 1/3 the patients have colonic polyposis, an increased risk of mortality from colonic malignancy. And the most significant effect of GH axis is on the cardiovascular system. There are chronic heart disease, cardiomyopathy, left ventricular hypertrophy, hypertension, and arrhythmias. Patient may develop gynecomastia and galactorrhea. There is increased level of IGF-1, and that is associated with goiter, and it produces to multinodular goiter. The patient feels weak and fatigue. What are the lab findings in acromegaly? Due to increased pulsatility of the GH, a single random sample is not useful. There is increased IGF-1. So how the diagnosis is confirmed? Diagnosis is confirmed by failure of the growth hormone levels to fall to less than 1 microgram per liter within 1 to 2 hours of oral glucose load of 75 milligram. About 20% of the patients exhibit paradoxical growth hormone increase after the glucose load. Prolactin is also increased in 25% of the patients. MRI is done for the pituitary adenoma imaging, and CT is done for ectopic production in the body. So what's the treatment of acromegaly? The treatment is drug, surgery, and radiotherapy. Somatostatin analogs are used as adjuvant therapy. And what's pegvisomant? Pegvisomant is a growth hormone receptor antagonist given subcutaneously daily. Pegvisomant antagonizes endogenous growth hormone action by blocking its peripheral binding to its receptor. So it normalizes IGF-1 level in 90% of the cases, and GH level, however, remains high. So what are the side effects of pegvisomant? There is abnormal LFT, which is reversible, and there is lipodystrophy at the injection site. So what are the other drugs used? The other drugs used are bromocriptine, cabergoline, and octreotide alone or in combination. What is octreotide? Octreotide is an octapeptide that mimics somatostatin and inhibits the release of growth hormone. So this is the difference between octreotide and pegvisomant. Pegvisomant prevents the growth hormone action on its receptor, but octreotide inhibits the release of growth hormone. Octreotide also inhibits the release of glucagon, gastrin, and insulin. The surgical treatment is transsphenoidal removal of both microadenoma and macroadenoma. And acromegaly recurs in 10% of patients. Hypopituitarism develops in 15% of patients. What are the advantages and disadvantages of radiotherapy? Radiation or radiotherapy is done for residual tumor. It reduces the tumor mass and growth hormone level after few years, but it may cause secondary malignancies in 2% of cases. But the advantage is that in the absence of radiation, 75% of the tumors recur. Due to hypothalamic damage, more than 50% of the patients develop pituitary deficiency in 10 years, and most patients require lifelong pituitary hormone